Alrighty, okay. Look, we're back. We're back in action. I had to turn the lights on. We're back in action, guys. Waiting for our special guest. As I mentioned, go grab your, there we go. My number one supporter's in here. The babe is in here. There we go. All right. So, hi guys. Sorry about the technical difficulties and all the things. I'm so excited to have everyone here. Can't you tell? I'm all dressed in pink. And yeah, the dress is okay. The dress is okay. The things are where they're supposed to be. So make sure you guys help me point out if there's anything looking a little sketch, because this is my first time actually not wearing sweats and all the sports bras and Nike Dry Fit after having a baby and launching a business and all this stuff. Thanks, babe. So we are gonna have a really great discussion. I'm waiting for our special guest. She should be joining us soon. She's a dynamic woman I feel like we met a couple of, what was like maybe 2 years ago? I'm not really sure. But yes, so I'm just waiting for her to join this live. I feel like she's probably on her live too, because we were having technical difficulties as well. So I know a lot of you guys are interested in seeing the Brooklyn Pink. I'm here to tell you right now, we cannot give you a tour at all because we have guests. We have guests here. We have people. We are booked and busy actually. Let me see if she could join us here. Waiting for you. So I know a lot of you guys asked a lot of questions about, breast cancer. I'm really excited to get this conversation on the roll. And I'm gonna stall a little bit. Forgive me. This is like my first time doing a live on my own, for real, right? Oh, hi. I see a lot of people that actually booked Girls Giving. There she is. Okay, I see her now. She view requested. Okay, I'm gonna accept her request. Okay. Child, see, this is why I stay producing people, okay? Thank you. Here we go. Did you guys see that? There we go. Woo, child.
There we go.
See that? I with the camera. So I was telling the people that I know a lot of people were just basically like, oh, we want a tour. And I'm here to tell it again to everybody. We cannot give a tour of the Brooklyn Pink inside the unit because we have been super fortunate and blessed and booked. So I'm actually in a shared space. I'm not supposed to be doing this. And my guest for the weekend, actually, she's been here for about going on 2 weeks. She's a really big influencer. I'm really excited that she's here. So I'm not going to say her name yet for safety reasons. But she was able to let me, use the gym for now. And yes, that's right. We have a gym at the Brooklyn Pink because, as you know, this doctor, you're Miss Curly Doctor. This should be really Miss Fit Ass Doc, like all the muscles Doc, abs Doc, okay? So we do have a gym here. So that's where we're actually shooting the Brooklyn Pink Pink Talk, our very first Pink Talk at. And I'm so excited to be joined by you. So we all have things to do. I just don't want to give too much just chat. I love to talk, but I actually want to just talk about this woman. And we met, if I remember correctly, right? We met at Earn Your Leisure event.
Yeah.
So shout out to the guys, the biggest ever. Those are like my brothers in my head, right? So we met there, and you have been dynamic. So why don't you go ahead and tell the people about yourself, give a brief introduction, and then we'll start unpacking these questions while I finish setting up everything else.
Okay, guys. So, hey, I'm Shari Andrews. I'm an emergency medicine doctor. I work here in New York. Actually, been in practice for about 10 years. I, like I said, specialize in emergency medicine, so I see various medical conditions throughout the day. But I also have a personal passion to serve my community, arm you guys with information and knowledge. And in honor of Breast Cancer Awareness Month, decided that it would be paramount to give you guys some information and tips just to, again, bring awareness and education to the community.
Yeah, when I feel like we first kind of started DMing about this about like a week ago or so. and I don't like getting on camera. If any of my friends know, I am a television producer, but I do not like being on camera. I get so nervous. I am the boss of people. I can tell people what to do, but I don't like it. And you were like, oh, I wanted actually you to do a live takeover. I wanted you to come here, which you are coming here next, soon in the future. But I was like, you could just take over my live. You're like, no, come on live with me. And I'm like, girl, get somebody else to do it. And it was my husband who was just like, no, you should do it. It's a really great conversation. People should see your face. So I'm telling you right now, this is not my, I don't like this at all. But it's a very important conversation. So and I think for us, the reason why we did this at the Brooklyn Pink is because obviously we are all about women. We like the guys too, but we are about women. It's all pink for a reason. And as I mentioned, background about me, this is Jordana Hemingway, guys. Just in case you guys don't know who I am, the co-owner of the Brooklyn Pink, New York City's premier pink Airbnb, content studio, event space, all the things. We're number one. Okay. So we started this. We had this idea in January, actually. And this was before the Barbie movie came out, so don't come for me. Don't think I did it because of Barbie. You can see my old TikTok. I time-stamped it. I started painting the unit pink in January, and it was because I wanted an Airbnb, and because of my background working with Matthew Garland, another earner, we were talking about real estate, and we were talking about like maybe the end of Airbnb is near. Maybe it might not be the same in places like Atlanta and places like New York. And I was just like, I knew of the Airbnb laws might be changing, but I honestly didn't think Eric Adams was gonna be able to pull it away. I thought he would be out there with Drake or something like that. So I said, if it does happen, we need to make sure it's different. We need to make sure it's something that people want to be in, and let's paint it pink. And I'm all about taking risks. If we fail, we fail. So what? We'll paint it white. Again, it's just paint. And we had to stop because I did give birth. So I gave birth to a little baby girl. She turns 6 months next week, and I'm so sad and excited and all the things. But I had to stop around like March because, pregnancy, all that things. And I had postpartum preeclampsia. It was a lot. So I had to stop, and then we actually geared back up in June. We launched in June, and today is only October 4th, right? We have about over 3,000 followers. The content has been good. Thank you, Beautiful Notary. It was a lot of work for us to launch this out. And a lot of people see the glitz and the fun stuff now, but most of the work was me DMing people like you at 4 a.m. saying, hey girl, can you come to my spot? Can you come check it out? 5 a.m., 6 a.m., breastfeeding and nursing and all these things, and reaching out to people that I admire like yourself to just collaborate. So first of all, I want to say here, thank you for even jumping on board and supporting me from afar. I think we just met at the bar over like drinks, and I'm like, I like you. You're like, I like you too. So and for us to collab on something so important like spreading more awareness about breast cancer, I think is super impactful. And that's one thing for me to make this my very first Pink Talk. I'm just super stoked about it. So the first question I have, and then we'll kind of go back and forth over the questions that you received in your DMs as well.
Sure.
Just for me, because I'm selfish, guys. So let's just talk about it. I also, before my baby, I had an open myomectomy. I had about like 12 fibroids. I'm telling all my business is fine because I do think there needs to be more awareness about fibroids as well. And I remember when I was going through that journey of researching and figuring this out, then I saw some stuff, and you can't go down the Google, down the rabbit hole, but I saw that sometimes there might be a correlation to breast cancer. I didn't know if that was on just WebMD and me going down the rabbit hole, or is there, or is there not? Is that factor or myth?
So as far as fibroids, that does not change one's risk for breast cancer. So no.
Okay.
And it's good that you got the myomectomies done because, certain masses within uterus can convert. You can get not convert, but you don't know what it's made of. So that's a whole separate issue than breast cancer.
Okay. And now the second question I have for you, because I'm just being selfish again, is let's talk about breastfeeding, right? So I have been, another reason why I kind of did this, I was like, let me answer these questions for me too, just make sure.
That's fine.
I've been breastfeeding, and if we have any moms in here, it is so difficult. It is so hard, but so rewarding. I love hate it. Motherhood is the happiest sad, the busiest bored,
You're not lying.
like it's just these emotions up and down that I cannot describe. And when it comes to breastfeeding, I would go on TikTok and see these women with these stashes of like deep freezers of milk. And just the other day I met this couple and we had dinner at their house and they had milk, and I'm like, where y'all getting this milk from? You know, and it was a difficult journey for me. And I mean, I'm doing okay, and no, I'm not judging anybody for their choices, because I'm telling you right now, like, the only reason why I think I haven't done formula yet is because I don't want to have to learn something else new. Like, I don't want to learn anything else new, okay? So breast, I know how to work my breast. So, but I also heard that breastfeeding kind of lowers the risk of breast cancer. Now, I didn't know if that was fact or myth. And can you explain that to the audience? Talk to me about that, because if that's the case, I might hang around this breastfeeding journey for a little longer.
So it actually is a fact.
Okay.
So breastfeeding can definitely lower the risk of breast cancer. And when you think about it, you're not seeing your period during the time that you're breastfeeding. That's because your estrogen and your progesterone hormone levels are lower because you're breastfeeding. And it's that exposure to estrogen and progesterone that increases one's risk. So breastfeeding is protective.
Oh, okay. That's interesting. I would not think that. The only benefit to me about breastfeeding so far, I mean, obviously the baby's fed. Yes, I get it. Cool.
That's important.
When I found out you did not get your period, I was like, oh, wait a minute. Sign me up for that. No period. Get into it. Yes, I was so for it. Now, it's not the same for everybody, so don't go all get pregnant at once, you guys. Don't do it, because I'm still breastfeeding, and I'm here to tell you I got mine last week. So, like, I think it depends on whatever situation.
And also it's time. So probably about 6 months, it would definitely suppress it. After that, it's hit or miss.
See, I thought it was as long. I thought I had a year. I was a year. You know, I was pregnant for about 10 months, and then I was like, oh, that's 2 years with no period. Yes. And then last week, I was just like, what is this?
Got bamboozled.
I don't know where to find. And guys, if you are in this chat, man, sorry, but this is the Brooklyn Pink, so we're talking all things breast related, women related, everything. But I was surprised by that. I was a little disappointed, because I was like, nah, this is not. I wish I had more warning, and I forgot the symptoms. Does your period change after having a baby? I felt like mine's got a little lighter. Is that like
for some women, they may notice it, but it's not like everybody has the same experience with
Okay.
that. So it would vary for sure.
Okay. So now I am 35.
Mm-hmm.
When should women, especially Black women, right? When should we start having these conversations about breast cancer? When do we, like, are we doing self-examinations? Like, let's talk to me about that. What should we be doing?
Yes. So, I mean, when you think about it, women at any age are at risk for breast cancer, right? So we should be having that conversation from a very young age, even in our 20s. And only because we need to, I guess, make sure that people are aware to get to know your body. So that could be through self-breast examinations. So it's not that you want to instill fear in anybody, but you want people to get to know what their breasts feel like. And if there's any changes or difference over time, then that's how things can be detected early. But as far as screening, the conversation about getting screenings done, typically it's around age 40. It used to be 50, but now the advisory boards that recommend that screenings start at age 40. And when I say screenings, I'm talking about like the screening mammograms, and sometimes even the mammograms with the ultrasounds as well.
Wow.
Yeah.
Wow. I mean, it's kind of similar with Black men getting screened for colon cancer, right? They keep like lowering that age also.
And also it's not that, it's more so if there's like a family history. So if there is a family history, then you want to start your screenings a lot earlier. So they say if there's a family history and like your first degree relative, then you want to start your screenings really for any cancer, but for colon or breast cancer, at least 10 years prior to when they were diagnosed.
Wow. Okay.
Yeah.
So very, it's scary when you say it like that, right? It definitely is a little scary, but I think the more information you have, the better prepared you are. And then you could just, I think, you know, a lot of people, we run away from information like that. We don't want to face it. We don't want to talk about it, especially like in the Black and Latino communities. We're like, no, we're good. I do not need doctors. At first, I was like, I don't need that. It's just a rip off of my health insurance.
No, not a ripoff. But you know what? I see someone asked if it needs to be done every year. And typically, yeah, your screening mammograms are once per year.
Okay.
And yeah, we usually say, again, by the book, start at age 40. But if there's a family history, then you should have a real specific conversation with your provider on when you should start. And even with genetic testing, that's important to do as well.
I mean, what are you seeing in your workplace? Are you seeing people get there too late? Like, what are the stats behind this?
Yes.
From your
Again, I work in the ER, so actually what I do see in the ER are when women do their self-exams and they feel something that they really don't think they should feel, they come to the ER. But unfortunately, we can't do much in the ER. In the ER, we would simply advise that they visit their OBGYN so that they can get the screening tests to look into that. So the emergency department is not where you would want to be or go to for something like that. But for certain, seeing your OBGYN, getting your regular screening tests, that's important.
Got it. Now, we had a couple of other questions. I guess we could kind of take turns, but do you want to go over the list that you kind of got, and I'll go over some of mine too?
Yeah. So, I mean, since we're on the topic, like we're talking about like...
Oh, sorry. We're not going to say people's names just because some of these people...
Yeah, no need to. But you might wonder, okay, well, if I could do a self breast exam, each month, then do I even need to worry about getting a mammogram? Like, why would I want to risk the radiation if I could just keep checking? Well, that's the whole purpose of a mammogram. Purpose of a mammogram is to pick up the things that you cannot feel. It's like your early power of detection. So any potential lesion that's in the breast that you can see on a mammogram is probably well before you can even feel it. So it's important to still make sure you're doing your screening tests because the mammo will see it before you can feel it.
Okay, you guys see it.
Yep, and the reason why that's important is if the mammogram picks something up and then you get your further testing and it's detected that there is a cancerous growth, removal or treatment in those stages, your 5-year survival rate's like almost 100%. But if it's like late detection where it's already more advanced, that's where it's like the later you find it, the worse the outcome or less survival rate. So I hope that makes sense.
Got it. So can you say that line again? It will see it before you feel it, right?
That's right. So early detection is key. Mammograms are important because it will see it on a mammogram before you can feel it to your fingertips.
Got it. Now I remember, I think I went to like a small all-girl Catholic school, and like our sex ed was not existent. I went to it was not existent. But the thing one of the sisters taught us was like how to do it in the shower. So is it still the same? Like you kind of raise your arm and you kind of just touch around, dig your armpit area kind of, and you work your way down?
Well, yeah, there's two parts. Like there's a part where you look and the part where you feel. So you can stand in front of a mirror, arms at your sides, you're just inspecting, a visual inspection. And what you're looking for are for major differences. Like if there's a lump that you're seeing, it's a big asymmetry. Now your breasts are not twins, they're sisters. They're a little different, but if you see major differences, then that can be a sign of an issue. Then you can put your hands at your sides and lean forward. And again, if you see any dimpling, any puckering, any bumps, the nipples, the color, anything that you're seeing, that would raise an eyebrow. And then you want to lift your arms above your head. And the same, as you do that, it lifts the breast a little bit. So you're again looking for any pulling or tugging or puckering of the skin. You're also looking at the nipple, if it's inverted or not. And any abnormality that you see is something to bring up with your doctor. So that's like the first part.
It feels like a little tight, I'm assuming you mean. Like if it looks, okay.
Yeah.
Like rippling skin, basically.
Yep. And then the second part is when you feel. So yeah, you can do this in the shower. You can do this upright. I usually like to recommend people do it laying down because it kind of spreads the breast tissue a little more flat. And then you want to make sure like you're using the pads of your fingers and you're checking all around the breast. And then the armpit, it's better to like lower your arm a little bit, not all the way up, lower, so you can get deep inside the armpit to sort of feel around if you feel any lumps or bumps.
Okay.
That's what I usually recommend. Some things people miss is breast tissue goes all the way up to your collarbone and goes all the way under the armpit. So you want to make sure you're checking all of these areas as well. Yep. Important to know.
This is technically boobish area right
The
here.
breast tissue can go all the way up here. Everybody's breasts are different, but yes, you want to check all the way up top. Absolutely.
That is fascinating. I did not know that. I'm like, so you need to tell me all this time I thought I was a little flat chested. It's just spread out.
It's spread out, girl.
It's all over. You hear that, guys? It's all over. So now let's talk about fitness because we got a lot of comments, a lot of questions about fitness and wellness and health and all of those things. And I know you, I mean, I was just telling my husband about you. I am fascinated because you're a mom. I'm assuming you're probably like we're not gonna be ages here. I'm assuming you're like mid-40s and you look like, no?
I'm in my 30s still, girl.
What? How are you a doctor?
What do you mean?
I don't know. I just feel like, doctors, you need to be like 40 and above. What?
I graduated med school when I was 25. I graduated residency when I was 29, and I've been working since. I turned 39 the end of this month.
We gotta have hand claps for you guys because, like, I don't know. I just assume, the Grey's Anatomy fan in me. So you're not a real doctor. This is not real. Like, how are you? So not even more amazing. Okay, so forgive me. You are a mom, from what I see. You are a doctor. I think we had also got connected through Tamara.
That's right.
COVID when it was crazy town during COVID.
Yeah,
and
right.
You were working through that in the emergency room. I can't imagine. You are always working out. And I'm like, I told my husband, I said, how does she do it? I don't understand how she works out. How does she look this good? She looks like she could kick some serious ass. So how does fitness, like, let's talk about that. Like, how does fitness and just diet, does that have any, does that help and lower your risk? I know that sounds like a basic question, but I feel like no question is stupid. Can we talk about the importance of health with that?
Well, absolutely. Maintaining a healthy weight, avoiding and limiting like your alcohol intake, watching what you eat, all of these things play a major role. And yes, they can all reduce your risk of cancer in general. It also boosts your immune system. So in terms of like sickness and, just getting sick easily, it doesn't happen when you're into, again, your health and fitness. So obviously I was trained here and I went to school in Brooklyn. I went to SUNY downstate. And in our training, you learn what we call Western medicine. So we learn about how to treat, prevent and treat diagnoses. However, I think it's more stressed on how we treat. Like the problem comes to us and we work on the treatment. But if you really look at everything that I promote, I'm trying to promote before the diagnosis. I'm trying to promote how you can prevent or lower your risk for certain things to occur. So that's where the holistic approach comes in. It's like fitness is definitely important, maintaining a healthy weight. In postmenopausal women, like estrogen is still produced and it comes from the fat cells. So the more fat you have as an older woman in your perimenopausal and menopausal states can also increase your risk for breast cancer. So it's always important to make sure you're maintaining a healthy weight. So exercise is definitely important. I'm always going to promote that.
I love that. So do you want to go through one of the questions you got? You want to?
Yeah, I wrote them down here. So a question I got was, one thing I've heard is that wearing bras with metal underwire can contribute to breast cancer. Is that a fact or a myth? So honestly, before reading this question, I had never heard of that before. So I actually had to look it up. And officially, it's a myth. There's no scientific evidence to support that wearing a bra with metal underwire is contributory to developing breast cancer.
Okay.
I think the idea and why it's been out there in media is because people said, well, the metal underwire is very constricting, like it's tight, so it's not allowing the flow of like lymph fluid through the breast. But they have studied it and they said that's debunked, not a fact.
Okay.
Another question I got was about antiperspirants. Antiperspirants have an active ingredient, aluminum, in it. And I've heard this on social media, actually, before I even heard it anywhere else. But they're saying like, oh, if you use antiperspirants with aluminum, that can increase a woman's risk of breast cancer as well, or actually cause breast cancer, because it's like blocking the ducts where your body's trying to get rid of toxins. And they also say like the aluminum activates the estrogen receptors. And then we all know with more estrogen receptors being activated that, oh, okay, well, that must increase the risk of breast cancer. I found like 3 studies and they all say, no, that's not true. But, but I'm human and, you know, I'm reading these studies and I'm like, I don't know. I'm not sure that it's a final word, to say the least. I feel like there are cosmetics that have parabens in it, and even the antiperspirants with aluminum, if they do interact with estrogen receptors. That has been scientifically proven. So if that's the case, I would have to raise an eyebrow to that. Again, it's not official. This is my opinion based on what I'm reading. So I would be careful with aluminum containing antiperspirants.
I literally have tried to throw away, I went down the rabbit hole and threw away like all of these things. I watched this documentary about get this out this house and stuff. I'm cleaning with like vinegar and stuff. And it's hard. It is hard to go clean and green and all the things. So I'm here to say I've been using one deodorant without the aluminum for like 2-3 years, but I ran out. The subscription hasn't renewed, all this stuff, and I went and got like the most probably cancerous stuff. I can't even do everything. I can't be perfect. So I went out and I'm like, you know what? I'm gonna get the deodorant with the cancer. I don't know what to do, but so it's good to know that I wasn't going crazy, because my family was like, oh well, you know, you're talking about cancer and deodorant, and I'm like, but think about it. You know, it's they have all these parabens and stuff. So it's good to know that I wasn't crazy. So I should stick with the deodorant without the aluminum. Try to find it if you do use that.
If I had to speak personally, so this is information, you guys, not official medical advice. So I'm going to speak personally for a moment, but I have both. So I have this brand called Schmidt's. It's aluminum free. It's a deodorant. And then I have a brand that's called Degree. It has aluminum in it. I pick and choose, right? So if I just shaved, I'm not going to use the Degree that has the aluminum in it. I'm just going to use my Schmidt's, my non-aluminum, my aluminum-free and deodorant. But like, let's say I have a heavy day ahead of me. I'm going to the gym. I don't know. I just got to make sure I'm not. Then I'll use. So I'm kind of like playing it semi-safe, right?
Because I'm like, depending on where I'm going, I want to smell musty. So,
but that's what I'm saying. It's like you gotta. I pick and choose, right? So I'm not using it every single day, but I'm deciding, you know, when I'm going to use it. And I also try not to shave right before putting on the aluminum containing one, because like I said, I did the research and I looked at the studies and it says there is no association between the two. However, when I look up like the molecular biology, aluminum it's considered a metalloestrogen, and it does activate estrogen receptors. So then I have to question, well, if you're using it every single day, and even on days where you get those tiny nicks in the skin because you've just shaven, I have to question that still. So if it's still under investigation, you know, we find things out later in life that you don't know. So I would suggest play it semi-safe.
Yeah, because I always think about those commercials that you see late at night. Like, if you were near the Twin Towers during 9/11, you may be, you know, I don't want to get caught out there. Like, if you use this brand of deodorant, you too might have, But
it's facts. It's facts. And there's things that happen over the years that changes the recommendations. Like, look, I'll give a few examples. We used to recommend pap smears once a year for women. Now they're saying, oh, you don't need it once a year. Every 3 years is enough. we used to recommend mammograms from age 50 and up, but now it's like, oh, let's start at age 40. The studies are showing that, so like with time, we learn more. So therefore, it's like sometimes you just have to do the research yourself and make some decisions for yourself. I think that's important too.
Love that. Love that. And now, did you have any more questions coming your way, or?
Yeah. Someone asked if it's true if breast cancer leads to brain tumors, or if that's a myth. So breast cancer in the later stage can spread to other parts of the body. So I wouldn't say that it causes brain tumors, but you can have spread of breast cancer to the brain. It could also spread to the lung. It could also spread to the liver. Once it spreads to other organs, that's considered stage 4. It's like the final stage of breast cancer. It's like 5 stages. So again, the lower stages, it's like, again, it's more localized, specific size, whether it's in the lymph nodes or not. That's how they sort of stage everything. But when it's in the later stages, it's not that it causes a brain tumor, but it does spread to the brain. So it can cause masses within other parts like brain, lung, and liver.
Love that. I mean, like, you're really spitting all this knowledge. And I think that was a question I'd asked because I'm in the process of interviewing a nanny, and she had mentioned that her friend had brain tumors right after cancer. Let me just ask. I'm going on live. Like, let me just ask a question.
Like you said, the question is dumb. Everything, it all matters,
Right.
And in the name of Breast Cancer Awareness Month, it's important to know as much as you can. But the whole reason is, again, increasing awareness also increases early detection. Hey, you picked it up like. Got it? I think I lost your audio.
There we go.
There we go.
Awkward. I'm not perfect. I just look like it sometimes on the Instagram. And now the final question I wanted to talk to you is about, sometimes there is like with the elders, right? I am trying to force, and I got a lot of this from my friends too. How do we talk to our moms about getting screening? Because the older people, they don't really believe in doctors at all. Like, how do you have these conversations with your aunts, with your moms? Like, it's very uncomfortable. I think that people our age, we're very comfortable with talking about our health. At least I am. I'll tell you everything because I'm all about just, because when I talk about my fibroids, everybody's like, oh my God, me too. So I'm an open book. But sometimes I feel like my moms and like the aunts, and I'm like, they don't really want to get screenings because they feel like, ugh. Do you have any advice?
Well, first I would try to identify what's holding them back. Like, I had a patient who told me she didn't want to get mammograms because she felt like doing mammograms every year is increasing her risk of cancer because it's radiation. But it's like, while mammos do have some level of radiation, it really is a very, very small amount that it's not clinically significant and going to cause cancer. And again, the power of detection is more powerful to find a potential lesion. So I would just identify, like, really what's the concern and why won't you want to get your screening test done? And then from that, that's how I'll be able to sort of identify, really how we can approach talking about it. And I do that every day with my patients. Like, when they come in and they tell me, or they're honest with me and tell me I don't take my medications, it's like, let's talk about why. Is it cost? Is it you don't like how it makes you feel? What kind of side effects are you getting? Once I can identify what it is that's holding them back, then I think it makes it a better conversation to have to convince them why it's important. And especially in older women, like I said, we've probably been here. Everybody in this live probably knows at least one person that has breast cancer or has been diagnosed. And I say that to say it's quite common. But then we might also feel like we all know younger and younger women that are getting diagnosed, even under age 40,
Yeah.
right? It's when you look at the big picture, the statistics say it's only 5% of women that are under age 40, but to us, it's like, it feels like more. But the majority of cases are over age 40, actually even past age 50. So older women need to make sure that they're on top of it. They have to get checked. Just because they're older, I don't want them thinking, oh yeah, no, I'm not at risk. you're definitely at risk. Actually, that's the majority of the population that gets
Well,
diagnosed, and more so Black women have
yeah.
the poorer outcomes.
The other thing too is that some people think, okay, it's an old disease. I'm seeing people getting it at like 38, 39. Oh, look, somebody said I just lost my
Oh
niece
my
at 38 breast cancer. I'm
God,
so sorry for
I'm
loss.
sorry.
It's happening. And I feel like, you think like I'm chilling. I'm outside, I'm drinking, I'm smoking my hookah. I'm not at that breast cancer talk, right? I'm not at that age yet. But the biggest takeaway from this conversation is just, go get screened. I am super inspired by this conversation. I'm so happy that you jumped on with me with all my quirks and weird stuff. Now I did promise my guest I'll be wrapping up around 7:45. So forgive us, guys. But this was a great way for us to collaborate. I'm just so excited that you were actually going to come here probably soon. Hopefully, fingers
Yeah.
crossed. She's booked with you guys. She is a whole doctor. So I'm like, this is so I'm like, just so you guys know, my ringtone to my phone is Grey's Anatomy. That's how much of a fan I think. I'm a doctor in my head. I think I'll be a neurosurgeon, but sometimes I play with ortho. I don't know. I can't do the ER stuff. I'm not with the. I went to the emergency room after I gave birth, and I was like, this is not like the TV shows. This is really ghetto and gross and scary.
Oh my
But
God.
I salute you. I am so proud. I'm rooting for you from afar. You give me like boss, energy, and you're a queen. And thank you so much for hopping on. Everybody, thank you guys for even joining the live to just talk about breast cancer. Yep, somebody said she's everything. Dr. Mom, fashion designer, and more. Yeah, I forgot. Yes, you want to plug the fashion line, girl?
Oh yes, Statement Piece New York, you guys. Follow me over there. I have a whole fashion boutique. I've designed. We've been in New York Fashion Week. Yeah, girl, I could go on and on.
Okay.
That's the plug. That's the plug.
Doctor slash fashion designer slash moms. Let me go drink bleach because your body looks amazing and I have no excuse not to work out.
Oh, thank you.
Thank you guys. And listen, so you guys check out the Brooklyn Pink. Obviously you're here, but we'll be posting more content. We are definitely booked and busy. So thank you guys so much for the support. We don't have any weekends really left for the new year. We're opening up our March books in January, which is a great thing. Don't ask about Valentine's Day. Don't ask about Galentine's. It was no 15 minutes ago, and it's no now, guys. We are working on something super exciting. So yeah, stay tuned. And if you guys need any photo shoots, hit us up. If you guys have any questions, it's myself, my husband, my BFF. We respond. We try our best to respond to everybody, and we do it. This is not our real job, guys. This is just a passion project. So I have a real job. I am so excited the writer's strike is done. I saw my homegirl Shanisha join. So I work at the Daily Show. My husband's a journalist, but this was just a passion project that he let me do. And he was like, okay. And if it fails, it fails, but it's been taking off. So thank you guys so much for joining us. Biggest takeaway, go get screened. Tell a friend to tell a friend.
Absolutely.
Let's take a picture because my friend Allison, she stays still and she takes a picture for the live. So you gotta give it a 5 count.
Who's gonna take it?
Well, no, I'm gonna screenshot it after.
Okay, go.
Ready? All right. Bye, guys. Guys. Bye.
All right. Bye.